Hi, my name is Lizzie Lyle. I am about to do my head-to-toe assessment. Today we are in my living room slash kitchen, and I'm doing it on my boyfriend Zach. And I'm gonna go wash my hands, and we're gonna get started. All right. All right. I've just washed my hands. Hello, sir. My name is Lizzie. I'm your nurse. Can you confirm your name and birthday for me?
My name is Zachary White, February 21st, 1997.
Okay. And do you know why you're here today?
To get a head-to-toe assessment.
Okay. Do you know where you are?
I'm in my living room.
Okay. And do you know what time it is?
It's 1 o'clock.
All right. Perfect. The patient has passed the neurological exam. They're aware of their place, person, and time. First, I'm going to get started. We're going to start with your head and neck. I'm just going to palpate your head and neck and scalp. See if I feel any lumps or lesions. Your hair is very thick. Your scalp is not dry. There are no lesions, no lumps. Is there any tenderness?
No.
Okay. Good. Now we're going to test your eyes.
Okay.
Now your eyebrows and your eyelashes are very thick. They're very equal. Your eyelids are equal as well, very symmetrical. I'm gonna just look up for me, and I'm gonna look at your conjunctiva. Your conjunctiva is pink and moist, and your sclera is white, which is very good. Okay, so now, if you'll just look at that poster for me, I'm just gonna look at your pupils. All right, those pupils are accommodating to that light. Now just follow my finger. We're going to test your 6 conjugate nerves, okay? Okay, perfect. Everything looks good. Everything is moving parallelly, very equal. Now let's look at those ears. I'm just going to check the external ear. I don't see any lesions or nodules. Everything looks very symmetrical. I'm just going to feel them. There are no nodules or lumps. Everything looks good. There is a little bit of earwax, but nothing out of normal. Can you hear this?
Yes. Yes.
Okay, the patient has passed the finger rub test. Now let's check the nares for patency. Just breathe in for me. Breathe in. Did you feel any tenderness?
No.
Okay, there was no tenderness, and the the nares are the noise conduction is noiseless. Sorry about that. Okay, so now we're going to check your facial features. Just make the same faces that I make, okay?
Okay.
Okay, great. The facial movements are very symmetric and equal. Now let's look inside that mouth. All right, the tongue is pink and moist. The gums are very pink. I don't see any lesions. The teeth are white. Overall, very good oral hygiene. All right, next, I'm just going to palpate. Well, first, let's listen to those carotid arteries.
Okay.
What I'm going to need you to do is hold your breath while I'm listening to them with the diaphragm of my stethoscope. Hold your breath. Okay, keep holding for me. Okay, everything sounds good. Now let's palpate those. Just one at a time. Okay, everything sounds good. Now I'm just going to assess your trachea. Just swallow for me, okay?
Okay.
Okay, the trachea is midline and non-tender. Okay, so now I'm just going to palpate your lymph nodes, everything like that. See if we feel anything on the back of the neck, maybe the top of the shoulders, in the front of the neck, under the chin. Let's just see if we feel anything? Okay, everything looks good. Now let's assess your range of motion in your neck, okay? So bend your head forward. Let's go backward, side, side, and left to right. Okay, perfect. Everything looks really good. The range of motion is very smooth. You have full range of motion in your neck. Okay, now let's go to your chest.
Okay.
First off, just looking at it, your costal angles are at 90 degrees and your slope of your ribs are at 45. Your AP to L is 1 to 2, which is within normal limits. Okay, now I'm going to get you to turn around.
Okay.
Let's just turn that way. You don't have to move the chair. Just, no.
Which way?
Turn the other way so the camera can see it. Perfect. Okay. Okay. So now I'm going to check for your chest expansion. Just breathe in for me. Breathe out. Okay, perfect. Now I'm just going to listen to your respiratory on the back. Okay, everything sounds good in the respiratory. I don't hear any adventitious sounds. I'm just going to palpate the back to see if there's anything abnormal. Do you feel any tenderness?
No.
Okay, everything sounds good. You can turn back around. Okay, now I'm just going to listen to your respiratory sounds on the front, okay?
Okay.
So just relax, breathe normally. Okay, everything sounds good. I'm just going to listen to you on the lateral side, so if you'll just raise your arms up for me. Just breathe naturally. Okay, everything sounds really good. There were no adventitious sounds at all. Now I'm just going to listen to your chest, to your heart. Let's see how that sounds, okay? Just relax. Oh, also, your respiratory rate was really good. All of your breaths were really smooth. Your respiratory rate was about 15 breaths per minute, which is very normal. Everything was really good. Okay. Now let's listen to the heart sounds. Sit up a little for me. Okay. Now I'm going to listen to the apical pulse for 1 minute. Okay, your heart rate was about 71 beats per minute, which is completely normal. Sounded really good. I could definitely hear S1 and S2. Let's listen and see if we can hear anything else with the bell of the diaphragm. Alright, everything sounds really good, very normal. Now I guess let's go to the abdomen. You can just lay down right here for me. Alright, so if you'll just bend your legs more, or not bend them, just scoot down more so your line is kind of flat, you know? Sorry. Okay, so I'm just going to lift your shirt up a little bit. Let me know, do you have any tenderness before we start this? Any pain? No pain? Okay. So I'm going to start in the right lower quadrant and just listen first. I'm going to use the diaphragm of my stethoscope to listen to the bowel sounds. Okay, bowel sounds sound good. There's one about every 7 seconds. Now let's just listen and see if we hear any vascular sounds using the bell. Okay, I don't hear any vascular sounds, which is a normal finding. Everything sounds really good. I'm just going to palpate to feel if I hear, feel if you have any masses or pain. If you have any pain, please let me know, okay? Everything feel okay?
Yes.
Feel good?
Mm-hmm.
What about now? Okay, perfect. There were no masses or any kind of lumps or anything. Everything feels really good. While you're laying down, we're going to test your Homan sign. It's going to let you know if you have a thrombus in your leg.
Okay.
So I'm just going to hyperflex your, hyperextend your foot and just let me know if you have any pain, okay?
Okay.
Does that hurt?
No.
Okay. And now what about that? Does that hurt?
No.
It's good? Okay, perfect. Now you can just come back, sit down for me. We're going to test your peripherals right now. Okay. So first off with peripherals, I'm just going to look at your skin. Your skin looks really good. It's very intact. Your texture is really smooth. Your temperature is very consistent throughout your whole body. Everything looks really good. Now let me test your your radial pulses. Okay, they are equal bilaterally. Now let's look at those fingers. Alright, your nail beds are pink, very round. Your angle on your finger is at 160 degrees, meaning there is no clubbing or anything like that, which is good. Now let's test the range of motion in your arms. Just do them in a circle for me, maybe backwards, up and down. Okay, now move your wrist for me. The other way. Okay, your range of motion in your arms is very good. Alright, now let's start looking at those legs. As I said before, your skin, your temperature looks really good. I'm just going to assess your tibial pulses. Okay, they sound good, or not sound, they feel good. Very equal bilaterally. Now let's test your dorsalis pedialis. Dorsalis pediis. Okay, they are very equal bilaterally. Let me check the capillary refill in your fingernails as well. Alright, your capillary refill is less than 2 seconds in your fingers. Let me check this hand as well. Okay, perfect. Now let me see that foot. Your toenails look pretty good. Your angle is at 160 as well. Your capillary refill is less than 2 seconds in that foot. Let me check this one. Okay, your capillary refill looks really good. It's less than 2 seconds. Now if you'll just stand up for me. Now let's just move that leg in a circle, both of them, please. Okay, maybe up, down. You okay? Okay, you can do the other one. Okay, perfect. Let's check those ankles. Just see if you can move them in a... Okay, perfect. And now let's check the other ankle. Okay, perfect. Now if you'll just walk over there for me. Okay, walk back. Okay, whatever. Now let's just do the Romberg test real quick. All you're going to do is you're going to put your legs next to you, put your arms next to you, and just close your eyes. Okay, everything looks good. His Romberg test was passed. There was a little swaying, but everything, his foot position, his posture maintained clear. He is very good. Everything looks very good. All his respiratory sounds, his heartbeats, his skin, his hair, everything looks really good. And that is the end of my head-to-toe assessment. Thank you.